Happy New Year. I want to send, on behalf of Rebecca and myself, a Happy New Year to you and your families. It's a tough time for our country, again in the Omicron wave of the pandemic. So we want to send best wishes of health and prosperity for 2022 to your family, to your community, and to all Canadians. And I want to particularly thank our frontline healthcare workers, people on the front lines who a few years ago thought that flattening the curve might be a few weeks or months or a year. Now we're approaching 2 years of this pandemic and its impact on our life. And I'll tell you, as a parent who had to get their kids all ready for their Google Classroom this morning, we are tired of lockdowns. We're tired of school virtually. We're tired of not being able to use the tools we have to keep people safe, to get life back to normal as much as possible. And I'm frustrated because the Trudeau government is almost normalizing lockdowns and major restrictions as the central tool for our country to use to fight COVID, despite the fact that after 2 years, we have so many incredible tools that we could be using to find the right balance to manage COVID if there was federal leadership. And I'm going to tell you why I'm so frustrated, because my first question in the House of Commons, after I asked about reconciliation, after I had had COVID, and Rebecca and I had shared our experiences with COVID and the great work by our contact tracing public health nurse, the first questions I asked, the first day in question period, was on the approval of rapid testing in Canada, a critical tool to help Canadians stay safe, to help reduce outbreaks, and to give people the power in their own hands to make sure that they can keep safe and keep others safe. We don't have rapid tests. Last June, before the election, I asked if Canadians had seen them. Most Canadians I know had never held a rapid test. And before Christmas, it was like the Hunger Games trying to get a rapid test in Canada. There should have been hundreds of millions of these tests being used already over the course of the last year. And the Trudeau government failed to deliver on that. The federal government approves, through Health Canada, a rapid test. And what is that? It is a simple diagnostic medical device. It's almost like an over-the-counter pregnancy test or something that you could administer yourself. This is not a drug. This is a key tool that has pretty darn good accuracy to allow millions of people to be able to self-care by making sure that they don't cause spread of COVID. Federal government approves it. Federal government procures it. Federal government distributes it to First Nation communities, the Canadian Armed Forces, Borders, the RCMP. We needed national leadership on rapid tests, and Justin Trudeau has failed. We needed rapid response on PPE and domestic capacity on PPE. They failed on that as well. The most recent order for Parliament Hill in the area in Ottawa was ordering PPE through China. Have we not learned the lesson from the first wave of the pandemic? Without domestic capacity for key tools like personal protective equipment, like masks, like gowns, like other PPE, you could be caught in a bind in another outbreak. So we haven't developed the very capacity to do that and to be self-reliant. Contact tracing. Do you remember that app that Mr. Trudeau promoted a year and a half, 2 years ago? Does anyone use that? Has there been any federal leadership from the borders right through to contact tracing? No, there hasn't. And of course, now with the vaccine, thanks to the great work of Canadians, we've had one of the highest uptakes in vaccines across the world. In fact, Rebecca and I got our boosters this week. Canadians have stepped up in a huge way. And the vaccine rates, alongside all of those other critical tools, can allow us to effectively manage COVID. But Justin Trudeau has failed to give us tools in sufficient quantities to be able to manage COVID. And what does that mean? It means finding the right balance between the primary goal of public health and public safety and maintaining capacity in our hospitals, alongside making sure our kids can go to school, small business owners can survive. We can have as much normal life with the right balance on public health. Using masks, using rapid tests, using vaccine levels, using social distancing, using all the tools to manage COVID. And why am I upset? Because like many Canadians, I watched Justin Trudeau on his doorstep. He kind of held the country in the palm of his hand and said what he was going to do in the first few months of the pandemic. In spring of 2020, he said, after consulting with the provinces, he was going to deliver on testing, on tracing, on data sharing, on federal management, so that we could get life back to normal and reopen the economy in a balanced way. He said that. And now he hasn't delivered on any of these things. And actually with big packages, they almost incentivize lockdowns as a tool using the federal government's spending power. But as I've said, the amount you spend is not leadership. It's delivering on what you promised to deliver on at the start of the crisis. It's learning from the first few waves of the pandemic, learning from the hoarding of PPE around the world and the fact that we needed domestic capacity. He hasn't learned that. Developing rapid testing, making them here at home, educating Canadians on how to use them. The Canadian Post Office could deliver everyone rapid tests, as some other countries have used to keep schools and businesses and other things open. Most Canadians can't even get their hand on a rapid test, let alone know how to use them. Contact tracing, most of it's been given up on because the app Mr. Trudeau released was a complete dud. And vaccines. Mr. Trudeau, rather than increasing uptake amongst some people that are hesitant, used that issue to run a national election and used it to divide Canadians. And with more and more lockdowns, I'm worried, as someone that has promoted vaccines, that videoed my vaccination with my wife. I want to make sure people get the vaccines because it's the best tool. And if we're always just going into lockdowns, you're going to see people use that as an excuse to not get boosted or not to get vaccinated. So we have to use all of the tools in the toolbox. And as I've said many times, leadership is not just about reading an announcement on your doorstep. Leadership is actually delivering on what you say are critical to get life back to normal. On a besoin d'un leader maintenant comme Premier ministre. Après 2 ans avec la COVID-19, les Canadiens et Canadiennes méritent un gouvernement prêt pour la pandémie, prêt avec les tests de dépistage rapides, avec des masques, avec des vaccins et des fonds pour nos hôpitaux à travers le pays. Les Canadiens méritent un gouvernement qui va apprendre les leçons pour répondre aux crises dans le futur. We need to make sure a government actually leads and learns, and that's what we haven't seen from the Trudeau government. So what are we going to do as Conservatives? I'm very fortunate that I've been working over the last few weeks with our special COVID advisor, Dr. Stephen Ellis, one of our new members of Parliament from Nova Scotia, Michelle Rempel-Garner, who's been a tremendous advocate. In fact, it was Michelle's pressure over a year and a half ago that finally got Canada to approve some basic rapid diagnostic tests. We were one of the last G20 countries to actually approve and distribute them in large quantities. She kept that pressure up. Et notre porte-parole pour la santé aussi, Luc Berthold, on a une équipe forte, ciblée sur un plan pour un équilibre entre la sécurité publique et la santé des Canadiens, des Québécois, et notre vie, les écoles, notre économie, et un retour pour la vie normale. So that's what our team's been talking about. We sent a letter before Christmas asking specifically whether we would be ready, whether we could have rapid approval of some of the therapeutic products. Some of the new therapeutics that look promising are being accelerated in the United States. And we can't even seem to get an answer from the federal government on areas of their direct responsibility. So that is what we're going to be talking about. I'm going to be talking about it more tomorrow with our team and sharing more thoughts with the Canadian public. We're looking at engaging the Health Committee to say the Trudeau government was covering up contracts, covering up their response to the health crisis. So they're only really ordering rapid tests in large quantities in the last month or two. We should have been doing this for 18 months. As I've said, I've been talking about it incessantly over the last year, and now when we critically needed them, Mr. Trudeau's failure of leadership has cost us. So as I said, we need tools so we can have as much of a normal life as possible, and that we don't normalize lockdowns as our first response to a variant when we have a high level of vaccination that almost reduces the ICU rates or the real serious health risks down to a very, very small number if you're vaccinated and double vaccinated and boosted. So let's get those boosters out. Let's get rapid tests in the hands of Canadians. Let's make sure we domestically make PPE and rapid tests and vaccines. Medicago in Quebec City is a very promising plant-based vaccine candidate. Il y a une entreprise au Québec, Medicago, avec un vaccin en train d'une application avec la Santé Canada. We need all of the tools to make sure that we balance public health alongside mental health, alongside the wellness of our children, alongside an economy that cannot just be in perpetual lockdown. And in fact, some of the federal government programs in the last year have almost incentivized lockdown. So Justin Trudeau hasn't delivered on the tools he promised back in spring of 2020 on his doorstep. And now he's really forcing the country to only use lockdown as the key measure. That should be the last resort. We should be using all of the other tools first. So like all parents, like many Canadians, it's frustrating. And for me, as opposition leader, when I've been asking about these things from day one, I'm glad today to see the media asking about it. There hasn't been enough questions about the lack of rapid testing in the last year and a half, about our domestic capacity. Why aren't we buying our PPE through Canadian suppliers? In fact, we called them heroes in the first wave. We were applauding all the small businesses that pivoted and created PPE. And recently, the Trudeau government's abandoned many of them. So the tools, PPE, domestic supply, testing, rapid tests in the hands of all Canadian families, effective tracing, surge support for hospitals through ICU support, through the Canadian Armed Forces, through partnering with provinces on long-term funding that let them build up that capacity, and vaccines. So I can't end one of these Facebook Lives without saying, make sure you get vaccinated. If you have any questions, ask. We need to find ways to reasonably accommodate people that won't be vaccinated. But if you can get vaccinated, do it. It protects you, it protects your family. And if you have any questions, ask them. Unlike Justin Trudeau, I'm not going to divide people over this. We can accommodate a small number that may not be vaccinated. We can use the other tools as well to try and find balance in life. Wouldn't it be nice to have balance in 2022 as a country? Return to normal as much as possible. Wouldn't it be nice to have a government that actually delivers on what they promise? So that's my kickoff Facebook Live for 2022. Rebecca, Molly, Jack, and I send our best to all of you, and Wexford, of course. Rebecca made an amazing store-and-away soup for MPs in my caucus and some special guests and friends, and people have been sending us our pictures of making soup over Christmas. I hope you've gotten some family time. I know it's a stressful time, but you're never isolated, you're never alone. Canada's best years are ahead of us, and as frustrated as I am, I know that we're going to push for better in opposition, and we're going to do better in government. So best to your family for 2022. Stay healthy, and once again, thank you to our frontline healthcare workers, to our essential workers. Keep it up. We're 150% behind you. Thank you. Bonne année, tout le monde.